Imagine the fear of feeling something isn't right during your pregnancy. Now imagine that fear compounded by the feeling that your concerns might be dismissed or minimized simply because of who you are. This is the reality for many Black mothers, a crisis hidden in plain sight. The statistics are shocking. Black women are 3 times more likely to die during childbirth than white women. It's a statistic that demands our attention. What are the issues impacting prenatal care for Black mothers? And how can we offer better support so that having a child can be a remarkable journey of transformation, growth, and creation? Welcome to People of Color in Psychology, the show that explores mental health topics specific to culture, diversity, and communities of color. I am your host, Jack Zen. I am pleased to introduce our guest today. That is Dr. Dorothy Hiralien, a licensed professional counselor, a bilingual therapist, researcher, and adjunct professor. Dr. Dorothy specializes in working with marginalized communities and provides access to care for all people. She has expertise in working with immigrant families, providing psychological evaluations for individuals filing for asylum, hardship, or VAWA, Violence Against Women's Act, and increased knowledge and experience in working with high-risk patients providing preventive care. In addition, she is the founder of a nonprofit organization, I Know You Can, Inc., that provides scholarships to Black high school students. Dr. Hiralien received her Doctor of Philosophy in Psychology from Walden University and her Master's of Arts in Clinical Mental Health Counseling from the University of St. Joseph. She worked as a bilingual clinician and bilingual outpatient supervisor at United Community and Family Services and is currently working at Empath Psychotherapy LLC as the CEO of Behavioral Health Services and as a clinician at a local community health center in her area. And prior to her clinical work, she was also an adjunct faculty member at local universities and colleges. As a Haitian American therapist, Dr. Hiralien will be discussing maternal mental health care amongst Black mothers and important things to look out for and address within the therapy session. Dr. Hiralien, thank you so much for joining us in this particular episode as part of our Black History Month series.
Thank you. I'm so happy to be here.
Part of Black History Month, it is important to also address mortality amongst Black women, which we have actually just have some data here, fortunately, still from the CDC that is still available,
Yes.
that there's actually been an increase in maternal deaths amongst Black women. And
Right.
so can you tell me about, just walk us through it from a therapeutic space, maybe share with us some of the work that you are doing with Black mothers.
Absolutely. I think I want to start with talking about what made me interested in this particular topic and made me interested in doing my dissertation around this topic. So back a couple of years ago at the start of COVID, I've had a particular person in my life who was going through some symptoms and they were reaching out to providers and they were being dismissed, ignored, said that they could be allergic reactions. And then thankfully, this person continued to advocate for themselves because they just didn't feel right. And thankfully they did, because when they did reach out to a provider, the provider ran some tests and they were alarmed that their symptoms were not taken seriously because it could have been tragic if it wasn't addressed at that time or even sooner. And so hearing this personal, experience from someone that I know, I was triggered in a sense because I was like, this could have easily been me. This could have been like, a family member of mine. And so I was determined that I cannot just sit and allow this to continue. I need to be part of, supporting Black women and helping advance in this topic. And so at that point, I was just like, let me do more research and see what I can do. And I decided to pursue a doctorate degree and do my dissertation around this topic. And thankfully, I was able to work with faculty who was supportive with this topic. And even though at times when it's time to collect data, I had some trouble. I'm not even going to lie. I had some trouble because I think there is some mistrust in the health system for the Black community. And so reaching out to participants, potential participants, was tough. But one thing that helped a lot was putting my picture on my flyer. I think they were able to see, like, okay, this is a Black person. They will understand my experience. And the moment I did that, I was getting so many people that were like reaching out and saying, hey, I would be interested. I would love to participate in this study. And so for my particular focus was hearing the experiences of Black women for prenatal care during COVID-19. Because, you know, COVID-19 was new for everyone, for scientists, medical providers, and even therapists. And so there wasn't a lot of research on that topic, specifically maternal prenatal care for Black women during COVID-19 using telehealth, because in-person appointments were not happening as frequently as they are now. And so after I did that study, as I was reading through the data that I collected, I realized that majority of the participants shared that they didn't get a lot of emotional support during their prenatal visits with their primary care doctors or their OBs, which I found to be alarming considering postpartum depression is very prevalent. And obviously it's a transition during COVID, having to have a baby. A lot of times people weren't able to have their significant other in the room with them. And then just transitioning, adding another person into the family. It's something new. And so a lot of the participants shared that they felt a lot of anxiety, depression, and some also had some post-traumatic stress from previous failed pregnancies or encounters with their medical providers. And so trying to navigate all of that during a pandemic was difficult. And so what I realized that as a mental health provider, it was important for me to understand how can I best support Black mothers when they come into my office, expecting Black mothers when they come into my office, seeking mental health support, you know? And so in doing so, I realized the PHQ-9, you know, this is an assessment that we administer on frequently, you know, but how much do we really take the time to really go into those questions and ask further details when some of the responses may be alarming? And so I also was discussing with participants and seeing how can we best, as mental health providers, collaborate with their primary care or their OB when there are some concerns. You know, I know with release of information needing to be signed, but how can we support Black mothers so that way they can have a trusted team, so that way they are not alone during this process? And so that was what really encouraged me to really dive into maternal care for Black women. And obviously we know that this is something that's been going on, knowing that Black women are 3 times more likely to die than white women. And so that's been a concern because, like I said, this can not only just affect me, but people in my family, friends, and, you know, and people that I can encounter in the work field, or even some of my clients as well. And so I wanted to participate in the research, you know, dive into the research, understand the research, and see how this research can help provide support, resources, policy changes within the community, so that way Black women can have a successful pregnancy.
Thank you so much for sharing that context, the history of your research, how you even got into this work. And for some listeners who may be wondering, well, this study was done in COVID. Well, hold on a second. So what? Because even during COVID, if you look at the data for Asians, white, and Hispanic, even during the time of COVID, the maternity mortality rate declined.
Mhm.
The only exception was amongst Black mothers. And
Correct.
so the same time period from 2022 to 2023. And so this is really an important piece. And you're saying 3 times. So for example, every, say, 100,000 births, say amongst white mothers, there were about 14.5 deaths.
Yeah.
But with Black mothers, 50.3
Yeah.
That's considerable because
Yeah.
it shouldn't be happening.
Right.
Okay.
Right.
And so that's why, Dr. Hiralien, the work that you are doing is so incredible and needed. Now, may I ask, when you were doing the research and the mothers were telling you, hey, we weren't getting the emotional support, did they mention what type of emotional support, or what did the emotional support, what did it need to look like, or what did it look like that was missing?
Yeah, absolutely. So one thing that came up a lot was the anxiety and depression. Feeling the anxiety was actually number one, feeling anxious because they potentially could have their baby alone in the room, with just their medical provider and not having their significant other there. And also, like, what if my baby has COVID? What if I get COVID while I'm trying to deliver my baby? What is that going to look like? What if I have COVID while I'm pregnant? Is that going to affect the development of my baby? So many questions that they were having. And honestly, providers were trying to stay up with the research, but the research was still developing because this was so new. But alongside the emotional aspect of it, there was participants that shared they're having physical symptoms that their providers were dismissing because they weren't having face-to-face appointments. A lot of the visits were through telehealth. Majority of their visits were through telehealth. And so having to explain to a provider virtually some of the symptoms that they were having, their provider weren't really able to see what was going on. And so at times the participants shared that, for one particular participant, they shared that they had a symptom and their provider was like, it's not a big deal. It's fine. Don't worry about it. It should be fine. Here's some steroid cream and you should be okay. But then when it was towards the end of her pregnancy and needed to do an in-person visit, her provider saw her symptoms and was like, oh no, something is wrong here. This needs to be treated immediately. And so for so long, this participant was suffering with these symptoms and couldn't have it addressed because they weren't having in-person appointments, and the provider didn't feel like it was necessary for her to come in to actually see what was going on. And so at that point, the participant was feeling depressed because she's suffering with these symptoms and she's being told like, oh no, it's totally fine. And she's been pregnant before. So at that point, she's just like, they say every pregnancy is different, but she didn't think it was going to be to that effect. And so I think having to deal with those physical symptoms and not knowing what the answers are, obviously anyone would feel depressed, especially during COVID, when you're not able to see your providers face to face.
Yeah.
And sometimes the providers were different. So one provider was, aware of what's going on, and then the next visit you're meeting with someone else, and they didn't get the chance to read up on your notes, so they don't really know what's going on, and you have to tell them all over again. So it was hard to do all of that and not feel like any of the providers were asking, like, how are you doing? How are you handling being pregnant during COVID and not sure how your labor and delivery is going to go?
Yeah. There's no support, essentially. I
Yeah.
mean, the mother, I would imagine this participant, the mother, is frightened because, like many, this is happening during COVID. But not just that, it's like, well, who do I reach out to? Because
Mm-hmm.
I don't want my baby to catch COVID. The other thing that I was reading up and thinking about, this an ongoing issue, is that high blood pressure is one of the concerns because
Yes.
it's the leading cause of preeclampsia, which we
Yes.
see this, right? And so when you're thinking about anxiety, mental health, well, it's related, right?
Yeah.
If you're nervous and scared and frightened,
Yeah.
you're going to be stressed. Your blood pressure is going to be up. So imagine this chronic experience
Mm-hmm.
day in and day out. So I want people to think about, well, there is this biopsychosocial social spiritual model that
Right.
is important to consider in working with mothers who are from marginalized groups. You need to consider this. Okay.
Absolutely.
So, Dr. Hiralien, tell me a little bit more about this fascinating work, your research, as well as your ongoing clinical work.
Yes, absolutely. After doing my research, I felt like, okay, it's time for me to put it out there, you know? And so I wanted to find spaces where they were interested in learning more about maternal care for Black women. And so I was invited by my chair, one of the chairs for my committee, for my dissertation committee, to participate in a conference, in a World Association International conference, to discuss my study and talk about my findings. And I've been looking for other conferences and places for me to bring this research to talk about my findings, and also finding ways that I can expand it, because I think, it doesn't just sit there. There's more. I'm sure the research has been updated, and so there's more out there that could be taken and, expanded on. And so how I take this into my personal work is, opening up the doors to work primarily with Black mothers. I know mental health is not something we often talk about in the Black communities. And so at times we tend to just deal with our problems by ourselves. There is the term of like a strong Black woman, and I allow them to come into my office and say, you do not need to be strong. It's okay if you're not strong. Especially if you're pregnant, it's knowing that you don't have to do this by yourself. And so once I had this research and I put myself out there to work with mothers, Black mothers, I noticed that a lot are coming in and sharing and saying, like, I'm nervous, I'm scared, even though this is my second or third pregnancy, or even I'm a first time mom and I do have a support, or some don't have any support. And being able to take what I know from research and apply it to our sessions, and knowing that the question of how are you doing, it goes deeper than that, and then allowing that moment of silence, because sometimes they really need to think about, like, how am I doing, you know? And it's not just to just check in, it's really to see, like, there's a lot happening. You're going to be a mom again, or you're going to be a mom for the first time. Where's your mind at this time? How have you been coping? How have you been taking care of you? Because a lot of times everyone gets excited. You're about to be a mom, like, that's so exciting. How's the baby? Without really checking in with the mom, like, how are you doing? And even with postpartum too, everyone's excited about this new baby. Let me see the baby. But then people don't really check in with, like, the mom is like, how are you doing? How are you taking in this new baby? And, how are you adjusting and becoming you again? Because before you was a mom, you was an individual yourself. And you don't want to lose yourself in that, or feel like other people don't care because everyone's so happy for the baby, which rightfully so, but you don't want to feel neglected in that aspect, because you do matter too. And a happy mom is a happy baby.
Yes. Happy mom is a happy family.
Yes.
Yes. Yeah. Huh. Hmm. Yeah. It
But
is
one thing
powerful. Yeah. Go ahead.
I want to mention too is I do find spaces where people are open to hear about this stuff, but I often wonder what more can be done, right? Because we can hear about these things, but what do we do with it? How
That's
do
a
we
great
apply
that's a great question. Oh, that's why we're here.
it,
Well, I mean, yeah, what do we do with this? I mean,
what do we do with
yeah.
this? And so for me, I had to ask myself that. It's just like, okay, I did the research, I'm talking about it, I'm bringing the results to the community, to the people that are, open to hearing about this. But what am I expecting these people to take from that? How do I expect them to take this knowledge and apply it to their work, apply it to their agencies? And part of it is the advocacy work, and it's putting myself in positions where I can help with policy changes within the agency. Like, I think that could be a start, or community groups in marginalized areas where Black mothers can come together and support one another. How can I encourage, these communities to come together and know that this is just a moment of a support space to be able to talk. But then also my clinical work too is applying my clinical skills in supporting mothers and knowing when they're not okay, how can I get them in touch with someone if they need higher level of care, and in making it a safe space where they can be receptive to that, because we already know that they have a difficult time just being in therapy. Now to be in higher level of care, it's like, what does that look like? what does that mean for me? Does that mean I'm not good enough? Am I not going to be a good mom? A lot of thoughts comes to that when you think about higher level of care. And so it's, how do I create this space where I can talk about higher level of care, and it's not something they need to be frightened about, but knowing that this is another resource for me to get support.
And you're doing this at a system level, a group community level, because these mothers are trying to give birth to the kiddo. However, the system has set it up where you're going in as an individual mother, but then where's the support
Yeah,
system at play structurally? It's
right,
almost as though if we truly support Black mothers, we need to also reach out. Hey, how can I collaborate with your OB? How can I collaborate
right,
with your doctors? Do we have a
right.
network of providers? Yeah.
Absolutely. Absolutely. And I had to realize, like, in the communities that I serve, is how can I bring my research to them? Because I think providers, medical providers, healthcare providers in general need to know how Black women describe their experiences with prenatal care during COVID, because I think it can help in terms of improving care, quality of care that the providers provide to their patients. And it just doesn't matter if it was just during COVID. I think, like we said, this has been happening for way before COVID. And it's still happening. So clearly, this is something that we need to talk about in the healthcare field with the providers specifically, because what are we doing? How are we failing our Black mothers? Why are their success rates so poor compared to other groups? And another thing that I found too is when a lot of times their symptoms are similar to white women. So if their symptoms are similar to white women, why are they not having success rates? And what I realized from participants is, sometimes their symptoms are being dismissed because I don't know if it's specifically like they don't believe them, but they don't feel like their providers take their symptoms seriously. And so that leaves them to suffer with their symptoms and potentially put them in harm's way, not for themselves, but also for their unborn child.
It's almost as though there's a feeling of or sense of the idea of not taken seriously is, well, these symptoms are possibly minimized
Yeah,
or just not heard, or oh, this is part of the process, as
right,
opposed to further investigation. Hey, let's look into
right,
this.
right, right.
Yeah, yeah, okay, yeah.
I noticed too from my research is, there is a lack of Black providers, professional medical providers. And it sometimes could be difficult to open up when you don't feel like, I don't think they'll understand. We think like, maybe I don't need to tell them because they don't really get it. Or the fear of just like, what if I do share this and they take it the wrong way and it's not how I want them to perceive it? And so the participants shared that the lack of providers that look like them also played a part in them feeling comfortable to talk about their symptoms or their concerns, because there is that mistrust. There is that mistrust due to previous medical history that we're not going to get into, that has played a part into how African Americans, Black individuals take the healthcare system that they have right now. And so a lot of times they turn to religion as a way to, get through some difficult times. They turn to family or friends to get through difficult times and just hope that things will get better, and rather than talking to their provider for the sake of like, I don't know if they will take this the wrong way and it won't be perceived the way it needs to be in order for me to get the right care.
I can tell this is very meaningful for you.
Yes, very.
Yes, yes. And now you told us how you got into the research, and I can tell there is a lot of passion in this work. Can you tell me or share with us memorable events or circumstances that got you into this specific line of work?
Yes. So, as I had the opportunity to go to college, get my master's degree, and get my doctorate degree, I know that this is not something a lot of students have the privilege of doing. I realize it is a privilege to be able to get higher education And so I wanted to kind of pass that along and give other students the opportunity, because I know that there is a lack of Black professionals within the mental health, healthcare in general field. And so I decided to create this scholarship where I can help Black students and high school students get into college, whether it's just getting them a textbook, or paying for a semester. It's just something to kind of just push them along and also encourage them, because I know how difficult it is. It's not easy for people to just sign up for loans. And obviously, we know, like, signing up for loans it could be good now, but then later having to pay them back and trouble finding a job. Like, there's so many obstacles, and I know that could be some of the barriers why a lot of individuals don't go to college. And there are obviously other reasons too, but I know some of them are related to financial. And so creating this scholarship, it was a way for me to pass it along to someone else, because I was able to go to college on a full scholarship. And that was because the school that I was applying to and those who donated to the school saw that I was worthy enough to get this scholarship. And so I think about those individuals who don't have the best grades, right? Does that write them off, that they don't deserve to go to college? And so I was like, I want to be able to create a scholarship where I don't look at grades as a merit for you to be qualified to get this scholarship. I want it to be more than that, because I realize, like, getting a grade is not everything. It's not all of it. And so with this scholarship, I, work to be able to build it up so I can work with students, high school students who are interested, even going to trade school. It's not even going to college itself. It's just being able to advance in your career, to find something where you can establish yourself and be a professional, be proud, make your family proud, especially for me as a first-time generation student, being the first in my family to get a doctorate degree, the first in my family to have a master's degree. I realize how important it is, and for my family to be proud, to know that, wow, if we fail at everything, at least I know, like, one of our children made it successfully. And thankfully, with my entire family, like, we've all been embedded with that education is important. And thankfully, all of us have been able to pursue education and excel in our careers. But I also think about those individuals in marginalized communities who don't have families that can afford for them to go to college, or even go to a community college or trade school. And so with this scholarship, it's a way for me to, expand more than just like the research itself, but it's just like, how can I help? What can I do with this information? I know that there is a lack of Black students in college. How can I help? Let me create the scholarship. If
Mm,
this is just one way I can just get one student to just buy them a textbook to get through a semester, I'm okay with that.
wow. And can listeners contribute to this scholarship?
Absolutely. We accept donations year round. You can check out our website. We're actually accepting applications right now. So if you have any high school students who are going into a trade school in the fall or going to college, please, please, please check out our website. I know you can.info to be able to apply, because we are accepting applications until March 3rd of
Okay.
this year, 2025. And like I said, we're accepting donations all year round. So whenever you feel like you want to donate, please do so. Even if you can't donate, but just share the information with, anyone that is graduating high school and going to trade school or college in the fall of 2025. Please, this is our 5-year anniversary. It started in 2020. So this is so exciting. We've been able to help 32 students,
Oh, wow.
with scholarships to go into their first semester of college, and even some that were going to grad school.
My
So
goodness.
it's been amazing seeing all these students apply, and each year our application pool gets larger and larger. So the word is spreading, which is great. But obviously we know, like, as the pool continues to expand, the need continues to expand, and obviously we need the money, and we are just solely based off donations. But thankfully each year we've been able to make it enough where we're able to award 5 students with a scholarship to go into a semester. And then we also offer book scholarships as well mid-semester to help them continue, because we know how difficult it is, where finances may not be there for the family, for the individual student, but they really want to pursue their career. They really want to be in college. They really want to go into trade school, but the money's not there. And so I encourage you, if you know someone that is looking, please check out our website, apply, because we end the application on the 3rd, and we're very strict on that because, like I said, the application pool is growing. We want to make sure that we get the funds out in a timely manner for students to be able to get their scholarship.
Yeah. Yeah. And of course, it's going to prepare for their semester, which follows a
Absolutely.
certain cycle. We'll
Right.
definitely include the information on the website and application information on our show notes. And so now, I mean, all this phenomenal work, Dr. Hiralien, can you share with me what were some challenges that you faced and overcame that you would be willing to share?
Yeah, well, as a Black professional, there has been times when you just have to prove yourself. A lot of times people can see my name, but then when they see the face, they're like, oh, wait a minute, let me verify, let me double check, let me check your resume to make sure that, you're qualified, you know what you're talking about. And so having to face that, having to prove myself, having to work 10 times, 3 times more than the next candidate for a position, for an opportunity in itself has been discouraging. And there are times when I was denied, you know, denied positions, even though I was overly qualified. And so I do face that in the work field a lot of times when I have to either present or even if I was applying for an opportunity, is feeling like I had to make sure that I had everything correct, because if I made one mistake, then this opportunity may never come again, you know? And because there's not too many Black professionals, there's not too many Black psychologists, is feeling like, I need to make sure I have everything in order because I don't want to screw it up for the next person that's coming in behind me, because I know there's not many of us. And so having that pressure and experiencing that pressure too, because we talk about it, but then when you actually experience it, it's different. You realize like, oh, this is real. Like, this does happen. But having to keep that in mind whenever I am trying to do my work or, applying for something, but then I had to realize like I can't put that pressure on me. I'm not perfect and I can't carry the Black community on my back. But then also for myself individually, I want to make sure that I present myself well, I do things correctly, but I also know that I'm not perfect. I may say something that be incorrect, and I can take, criticism, I can take feedback because I know that. But what does that mean when I'm in a group of white individuals? What do they think of me? Do they now think of like, oh yeah, like this one Black woman, she's here, she doesn't really know what she's talking about, and we have the facts to prove it. And that has happened to me where rather than coming to me in a way to, provide feedback, which like I said, I'm open to, it was more of like sending mass emails with all leadership professionals in an email to correct a mistake that I made, basically calling me out, Um, and I didn't take it well because it's just like, oh my goodness, like you just exposed me to like all these professionals and leadership management position leaders. And how do I respond to that? Like it makes you feel uncomfortable, it makes you feel little, honestly. But I had to respond professionally because I'll always be a professional, and accept that I did make a mistake and then take it from there, because I understand that the spotlight is on me. Unfortunately, as much as I don't want it to be, I just want to do my job and do it effectively and efficiently. I do realize that for some people, it could be a competition,
Mhm.
or they could feel like maybe she doesn't know what she's talking about. Let me see if she does. And they want to take that as an opportunity to either belittle or make me feel little or uncomfortable, I should say. But I've been in situations where that has happened, but thankfully in the beginning when it did happen, it did take a toll on me. I'm not gonna lie. It did, because I was like, what's going on? Like, this is really hard for me to accept. But then as you start to grow a little bit professionally, you realize like not everything you need to take personally. And there are some things that you may just have to let them go, like choosing your battles, and then also knowing when to advocate for yourself and professionally stand up for yourself to make sure that people understand who you are and your qualifications, and they understand how to approach you when there is another situation that comes up, because things do happen.
Mhm. Wow. To face, I mean, that type of challenge at a professional setting, it's unfortunate, and having to still maintain that professionalism, even though
Mhm.
others are not.
Yeah,
And that's, that, I'm just going to name it. That's the racist environment that we are in. Uh,
unfortunately. I remember there was one specific time when I was called out in a group of leaders and I had to defend myself, and I tried not to break down and cry because I was so embarrassed, and I was able to successfully defend myself without crying, but of course after I left I cried. um, and one of the feedback that I got from one of the individuals that was in the room was, it was hard for us to believe you because you didn't sit there and cry. And I was like, was your intentions to break me down? Is that what you was looking for? You wanted me to cry so that way you can believe me? Because it wasn't enough for me to just say that this is not what happened. And it just reminded me, like, I really, if I was to break down and cry, what were they gonna say? Like, okay, we believe you because you're crying now, or you're
but
crying.
eliminate that. That's, besides the fact. Why can't you just
Right,
take the information as face value,
right, right.
right?
And it
That
goes
goes
to
back.
show, like,
Yeah.
I have to prove, like, I'm telling you the truth, or this is what's happening, or I know what I'm talking about. And they wanted me to cry, and because I didn't cry, it came off like I didn't care, or I'm at fault, and I'm trying to cover up. And so those are some of the situations that I faced in the past, and many others have also faced after I, found a community of people that I could talk to about this, and they all shared similar experiences. Like, yeah, sounds very familiar.
Mm, mm. So to take that challenging experience, this isn't one experience, it's a
Yeah.
series, right?
Mhm.
So now thinking about today, as a Haitian American psychologist, what does that mean for you?
Oh my gosh, I am honored, because in the Haitian community, we don't talk about mental health. And so being a Haitian psychologist and being able to advocate for Haitians, considering what's going on in Haiti right now and the emotional impact that it has on everyone who identifies as Haitian American or Haitian, and being able to support them and talk about depression, talk about anxiety, talk about trauma. Like, there's significant trauma that is happening right now, that has been happening for many years, where as a Haitian community, we've been strong. We want to be strong. We take pride in being strong and pushing forward, and being that person that I can talk to, then where they can break down and talk about the conditions of our country and what's going on in Haiti, and how many individuals, mothers, fathers, children are suffering, and talking about, the significance it has onto what's next for Haiti, what's going to be happening for our country. But also too is just like, it's also fun to be able to talk about something that's so taboo, and realizing that so many people, can relate. So many people are actually opening up and saying, yes, I can finally not feel like I need to do this by myself. I have been feeling depressed for a very long time. I have been feeling anxious for a very long time, but we don't really talk about it. So I just did it by myself. And so being able to be someone that can advocate for mental health services within the Haitian community, within the Black community, it's very rewarding. And I'm very passionate about it. As you can tell, like, I love talking about mental health services. I love talking about maternal care for Black women, and being able to support and be a resource to them, whether it is just to talk about how's your day going, or saying, hey, I need more than, where can I go? Who can I connect with? And being that person that can connect them with someone else, and being that network of people that they can call on if they need something, or if they need to just talk. And so, as a Haitian psychologist, I take pride in the work that I do, not only for myself, but for my family. Like I said, I'm a first time generation student. So, this is something that's very monumental for us in the Haitian community as well. And knowing that there's so much crisis that's happening in this world, and I can help. I'm qualified,
Mhm.
I'm licensed to help, and I can actually make a difference.
How can we support you?
Well, one of the ways you can support me, with my scholarship, like I said, I know you can. Inc. is something that I developed in 2020 and is a way for me to help Black students. And so whether it's spreading the word with your students, if you're a teacher or as a professor or the parent, sharing that information with those high school students, spreading the word, donating if you can. We accept money, even if it's just to be able to mentor some of our students. Whenever I award scholarships, I always share it on our social media platform because I feel like it's a way for the students to connect with other professionals. I've had that experience before where one of our scholarships students, our scholars, I like to call them, connected with a professional and was able to get a job after college. I enjoy being able to connect and pave that way for students because I know how difficult it is to get out there, figure out what's next for me after college or what's next for me after high school. It's nerve-wracking trying to figure out. There's so many different things that you can do. And so this scholarship that I have is something that I'm passionate about. And I want to be able to expand it so that I can continue to grow, continue to help a lot more students. And like I said, this is our 5th year, and I'm hoping for another 5, 10, 15, 20, even 100 years, that it continues to grow and it becomes the scholarship that I've always envisioned it to be. And I've always said my dream is to be able to pay for at least one, but I'm hoping for many more, at least one student to be able to pay for their whole entire 4-year or 2-year, 18-month program, and that they can go to school completely free.
Yeah. Well, Dr. Hiralien, this is just amazing, phenomenal work that you're doing.
Thank you.
Yeah. Any final thoughts?
One thing that I like to mention is this is heavy. This is a lot. And don't feel like you need to do it by yourself if you're a Black mother, knowing that there is support out there. But even as a mental health provider, knowing that maternal health is a fundamental human right, essentially, and it's crucial that we address the disparities Black women face in maternal care, systemic racism, lack of access to quality health care, the implicit biases in the medical field contribute to alarming disparities in outcomes. So to truly support Black mothers, we need to listen to their experiences, advocate for equitable healthcare policies, and ensure every woman has the care and respect she deserves before, during, and after their pregnancy.
Thank you so much for that message. And thank you so much for your commitment.
No problem. Thank you. I enjoy the work that I do. And, I'm happy to be part of this group of individuals, Black psychologists who contributes to research and also mentoring upcoming psychologists and, that's currently in school. I understand that it's difficult, but it's definitely needed. And there is a support out there.
All right. Well, Dr. Hiralien, thank you so much for your time. A huge thank you to our listeners. If you enjoyed this episode, please share and subscribe to People of Color in Psychology. You can also support us by registering for continuing education courses or making a one-time donation on the Multicultural Counseling Institute's website. Your feedback is important to us, so feel free to send an email, a message on LinkedIn, or leave a voice message on our website. Until next time, this is your host, Jack Sun.